Hello, everyone. My name is Brandon Beatty, student physical therapist at Howard University. Today, I will be presenting my capstone on the effectiveness of hip arthroscopy in soccer athletes, a comparative analysis of interventions. So, to give you all some background information, femoral acetabular impingement, otherwise known as FAI, is a condition that affects the hip, and it's been more prevalent among athletes and has increasingly diagnosed since the 2000s. The condition occurs when there's an abutment or an impingement rather of the acetabulum along the acetabulum here along the femoral head. So signs and symptoms associated with FAI include pain located at the groin or hip that worsens with activity, stiffness, and limping. So the purpose of this study is to create a systematic review that will gather enough evidence on the return to play time for soccer players diagnosed with FAI who have undergone hip arthroscopy for treatment. So going into a review of the literature here, soccer is a beloved sport that's played by millions around the world. According to a research study by Locks et al., Locks and colleagues found that there was injury incidents are about 5 per 1,000 hours of exposure to play. According to the same study, hip-specific injuries accounted for 11 to 16% of total injuries experienced in the sport. And over the years, the identification of FAI has been one of the leading hip pathologies found in the sport. Right, so we'll delve in a little deeper into femoral acetabular impingement. There are 3 types. We have our CAM morphology, where there is a overgrowth of the femoral head. Then we have our pincer morphology, where there's an overgrowth of the acetabulum impinging on the femoral head. And then we also have a mixed morphology, which is a combination of the two. So when it comes to hip arthroscopy, this was first introduced in 1931 in a cadaver study, but it didn't become popular in the US until 1977. There are several components to this procedure. Of these components, it includes patient positioning. The patient can either be positioned in supine or side lying, depends on the surgeon's preference. The surgeon then assesses the patient's range of motion. Distraction is then added, or there's distraction of the femur rather, in order to create an opening for proper viewing and debridement if necessary, as well as portal placement. So there are 3 portals used for this procedure. There's the anterior portal, the anterior lateral, and the posterior lateral portal. So the 2 lateral portals are placed over the superior margin of the greater trochanter in its anterior and posterior borders. And what happens is there are guide wires that are used through both the posterior and anterior lateral portal, and then eventually those guide wires are replaced with debridement tools, and the anterior portal is actually used for a camera to go in there and scope or observe the area rather. So when it comes to physical therapy for FAI, there is existing literature to suggest that rehabilitation supervised by a physical therapist is recommended in order to restore muscle function and range of motion so the athlete can return to their pre-injury sport, hopefully at a better level of play than they came in, or excuse me, hopefully with a better level of play before they got injured. Typically, the physical therapy process, or typically interventions rather, emphasize on strengthening local musculature, being the hip flexors, hip abductors, gluteal muscles, as well as core strengthening. So when it comes to return to play, it depends. An athlete's ability to return to play is contingent upon the quantitative measures used that assess strength, function, and levels of pain. There is still a dearth amount of research that suggests a universal timeline for returning athletes to their pre-injury sport after hip arthroscopy. And that's why I kind of found it interesting to conduct this systematic review, because I felt like there should be more research done and there should be more of a definitive answer to athletes' return to play time if they were to have FAI and undergo hip arthroscopy. So my questions for this research project are, what is the difference in return to play time for soccer players with FAI who have undergone hip arthroscopy combined with physical therapy versus those who have received a hip arthroscopy without physical therapy? What is the difference in return to play time for soccer players with FAI who have undergone hip arthroscopy versus those who have only received conservative treatment? Lastly, what is the difference in return to play time for soccer players with femoral acetabular impingement who have received hip arthroscopy versus those who have received no form of treatment? My hypotheses based on these questions: soccer players with FAI will return to play faster if they undergo hip arthroscopy combined with physical therapy in comparison to those that have received hip arthroscopy without physical therapy. Soccer players with FAI that have received conservative treatment will return to play faster than those that have received hip arthroscopy. Soccer players with FAI who have received hip arthroscopy will return to play faster than those that have received no form of treatment at all. The methodology for this research project here, a researcher completed an extensive search to find a researcher conducted an extensive search to determine an average return to play time for soccer players who have undergone hip arthroscopy. So the primary research databases that were used in this research project were PubMed and Web of Sciences. The search terms that were used include FAI, impingement, soccer, return to play, arthroscopic management, and sports. After screening, a total of 15 articles were included. For these selection criteria, articles were included if they met the following criteria: articles written in the English language, articles that mention soccer players undergoing hip arthroscopy for FAI, articles that mention return to play time, as well as articles that include quantifiable outcome measures. Articles were excluded if they were deemed systematic reviews. If the articles did not include soccer players in the examined population, and if the articles did not mention the soccer players or did not mention soccer players with FAI. So going on to the appraisal tools. So since I didn't find any